More than 22 million people in the U.S. have asthma and asthma symptoms, which include coughing, wheezing, and shortness of breath. As you can imagine, all of those can have a negative impact on a patient's ability to perform their daily activities. Now, a new survey explores these asthma patients who continue to experience these symptoms. And here to tell us more about it is Dr. Purvi Parikh, along with Tanya Winders, President and CEO of Allergy and Asthma Network. Good morning to you both, ladies. So great to have you on the show this morning.
Good morning. Thank you for having us.
Dr. Parikh, what is it like for patients who struggle with asthma? What is it like, that daily interruption?
Right, so about 22 million Americans struggle with asthma, and common symptoms that they may experience on a daily basis is coughing, wheezing, chest tightness, waking up in the middle of the night, missing work, school. So it can have a significant impact for these patients.
Talk a little bit about this survey and the new findings and how that is helping patients.
So Allergy and Asthma Network partnered with Boehringer Ingelheim Pharmaceuticals to conduct a survey of over 3,000 Americans, adults living with asthma, and 850 healthcare professionals to assess how well controlled their symptoms were, to assess the severity of their asthma symptoms, and also to identify what's actually occurring in the course of their routine care visits with their healthcare provider. And surprisingly, the survey identified that there are communication gaps that are occurring between patients and healthcare professionals. So in fact, patients would say that they are well controlled when greater than 2/3 of them are actually limiting their daily activity, such as playing outdoors with their children or going to work or school, versus those that are saying that they think they're well controlled.
So what should we do about it? Those allergy sufferers out there that are looking for some relief, maybe. What's the first thing we can do?
Well, the best thing is to get in and see your physician, and both the patient and the physician have to be very actively engaged, and we have to make sure that we're asking the right questions, because as we mentioned, 70% of patients who felt they were controlled were still having symptoms, and almost 84% of doctors feel that patients should not be having any symptoms if they're well controlled. So there's a huge disconnect. So as physicians, we need to ask better questions as to how the asthma is affecting their daily lives. And then patients, too, need to feel free to be honest and forthcoming so we can make sure that they are on the right medications and are not suffering.
So the good news is that there is relief for those allergy sufferers out there. Is there anywhere we can go online to maybe learn more about your partnership and what you guys are doing to help people?
Absolutely. At openasthma.com, you can learn more about the survey results, as well as some of those particular questions that you as an engaged patient can ask, and what you should expect your healthcare provider to say to you, to ask of you each and every time that you go in for a routine care visit.
Ladies, thank you so much. I'm glad to know that there is some relief out there, some good news for those people who do suffer with allergies. And again, send us to that website one more time as we close here.
openasthma.com.
You can also go to our website for more information on this. Just head to fox4morningblend.com.